Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing. Okay, ready?
Welcome
to Eat, Move, Think,
the show about
optimal
wellness brought to you by Medcan.
Yeah, this is extremely good. Thank you.
When does your fertility peak, and what sort of changes can you make in your lifestyle to make sure that your pregnancy is a healthy one?
I don't have any idea.
How much protein should women eat in their 30s versus when they're in their 60s? And how does that change depending on your level of activity? At what age should you really start paying attention to screenings and tests like a pap smear or a mammogram?
These sound like fascinating questions.
Fascinating and popular questions. Our two guests today get asked questions like these on a regular basis.
Okay, so who are our two guests?
We have Dr. Zelovitzky. She's back, and she's teamed up with another Medcan expert who I would say is definitely a favorite Medcan expert.
Leslie Beck.
That's right. Leslie Beck is registered dietitian and the clinical director of food and nutrition. And the two of them together are a superpower, I would say, in terms of their knowledge and how far it expands for women going through every single life stage.
Their expertise in women's health comes not just from the body of knowledge that they've accumulated professionally as, a medical doctor, certified menopause practitioner, and a registered dietitian, but also day in, day out, hearing the concerns, the issues, the problems that confront women at all stages of their lives, and then helping clients work through those problems.
This is a really lovely little package that guides all of you out there through the physical and hormonal changes that happen to women's bodies as we go through 30s, 40s, 50s, 60s, and beyond, and how you can continue to promote your own wellness as your body goes through those changes. Not only are Dr. Zelovitzky and Leslie Beck extremely accomplished experts in their fields at Medcan and across the whole country, they're also women themselves talking to other women about these topics every single day. They're uniquely qualified to speak on these issues in a way that not many other people are. I'm Jasmine Ratch.
I'm Chris Shulgin. We're the producers of Eat, Move, Think. Okay, this sounds like a great episode, one that I think will answer questions for women of all ages.
Yeah, and you know what the best part of this is? If your question isn't answered, you could go see Leslie Beck or Dr. Zelovitzky at Medcan.
That's right, and we'll put how to arrange an appointment in the show notes.
So check that out, but first, listen to this episode. It's really amazing. Lots of tips. Let's get into it. Here's Dr. Jennifer Zelovitzky.
Hi, Leslie. How are you today?
I'm great, Jen. How are you doing?
I'm doing well, thanks. I'm really excited to have this chat today because I think we're going to talk about changes across the decades for women and what they should expect from a health and nutritional perspective. And I think it's a really exciting time to be taking this topic on, don't you?
Oh, absolutely. And we've got so much to talk about. I mean, it's no surprise that women have different nutrition needs than men, hormonal changes that you're going to talk about, pregnancy, breastfeeding, menopause, all of those things that you're an expert in really can affect a woman's daily need for nutrients, her diet, her physical activity level. So we're going to have a great discussion.
Absolutely. And it's a really exciting time to age for women. I have to say, with the changing tide in terms of menopause hormone therapy, in terms of how much we know about nutrition, how much we know about the importance of physical activity, it's an exciting time because I think there used to be a lot of trepidation and fear around aging. And from what you'll see today for our listeners, I think you'll take away a little bit of reassurance that you can age in a way that you have a little more control over, that you can live healthfully and with a high quality of life well into your 70s, 80s, and beyond. And hopefully will help give you some information that will empower you to make those changes starting today.
So let's start with the 30s then, Jen, building the foundation. What are the key physical and hormonal changes that women experience during this decade?
I would describe the 30s as sort of a stability in terms of hormones and metabolism. Women tend to be experiencing these nice regular fluctuations of their hormones as they have their regular monthly cycles. There's a lot out there right now on the internet about, cycle syncing, but I'll just tell you, there's not a ton of evidence around that. It's really just important to maintain the same habits throughout the month and throughout each cycle. So we know that fertility peaks around age 25, and then it starts to decline really in the 30s and particularly after age 35. Similarly, muscle mass really peaks in our 20s and then begins to decline in our 30s. A lot of people don't recognize that, unfortunately, until it's too late. So I would say it's really important to be starting to think about your physical fitness routine, your strength training, developing these habits that you can then maintain for a healthy lifestyle. The other key thing that I'd like to say is that the 30s are a time to really continue thinking about cancer screening if you're not already doing that. We recommend starting cervical cancer screening at 25. However, you want to be having that PAP test every 3 years, as long as it's normal, until you're age 70. So this certainly doesn't stop in your 30s, even if you're having children, if you're in a stable relationship. It's equally important then, as well as sexually transmitted infections. If you're dating, if you're out there on the scene, if you're sexually active in any way, it's important to remember to get screened once a year, because many sexually transmitted infections are asymptomatic. And if you don't know about them, they can progress and eventually lead to infertility. So although you might not be thinking in your early 30s about your future fertility, you don't want to take your eye off the ball if it is something you're going to be thinking about in your mid or later 30s.
And I think this is a really important time, this decade in our 30s, for women to be starting to really focus on optimizing their diet, to be following an overall healthy eating plan, choosing nutrient-dense foods like fruits and vegetables, whole grains, more plant protein like beans and lentils and nuts and seeds. I encourage clients to really be minimizing refined grains and added sugars, of course, and limiting red meat and processed meat as well. And to your earlier point, this is also, as you said, a decade when age-related muscle loss begins. And after age 30, we actually lose 3 to 8% of our muscle every decade.
Wow.
So, and less muscle over time, means that your body can burn fewer calories. So some women in their 30s, I hear this a lot, I'm sure you do, say that, losing weight isn't quite as easy as it used to be. Mm-hmm. But as you said, I think, in terms of mitigating that age-related muscle loss, women and men should really, really add resistance training to their weekly fitness routine if they aren't already doing so.
Absolutely. And I think especially when we're talking about women, right, at our female clients, I see it so often. We're sort of hardwired to think that we should be exercising to get smaller, right? So a lot of cardio, a lot of running, a lot of sweating, and you start to see that it's not working as well. Well, that's because we're losing this muscle mass, right? So you have to exercise to get stronger.
Yeah, that's an excellent point. And along with that, I tell women repeatedly, get your protein, include a really good source at every meal. That's so important.
Right.
While resistance training is the most potent stimulus for muscle protein synthesis, you need extra protein as well.
So I would say that this is a very timely topic, because you and I sat on a panel. We did a Q&A last week or 2 weeks ago, and I would say 70% of the questions were directed at you and were about protein optimization and protein intake. So when we're talking about women in their 30s, I see a lot of women in my practice who are vegetarian or vegan. They struggle to meet their protein targets. So where can they look to, or what can they try to do to make sure they're getting the protein they need at that age?
If women are following a vegetarian diet, they may or may not include dairy and eggs. So those are good sources of protein. But really, women, especially women who are eating a fully plant-based or vegan diet, need to include a variety of plant protein foods in their diet. So things like chickpeas, kidney beans, lentils, edamame, firm tofu, tempeh, using non-dairy milks. Many of them have very little protein. So read labels. So some of the better choices for protein would be soy milk. There are chickpea milks out there today that have a good amount of protein. And the same thing for non-dairy yogurts. Read labels and look for sources of protein. So just really be including those kinds of foods and a good source of protein at each meal.
Perfect. And from a hormonal perspective, fear not the soy. I do get a lot of questions about soy and it's linked to estrogen. I will reassure you right now, there is no evidence that eating a lot of soy increases your risk of estrogen-dependent cancers such as breast or uterine cancer. In fact, I always use logic, where scientific evidence is too dense to get through. But really, if you look at Japan has the highest intake of soy probably on the planet, and one of the lowest rates of breast cancer. So just from a logical perspective, if you don't want to lean on the science, you can just lean on the real world evidence there about soy. So do you have a specific recommendation in terms of how much protein women can target in their 30s?
So for sedentary women, the official daily recommended intake is 0.8 grams of protein for every kilogram you weigh. So you can do the math there. For women who are active, physically active, working out regularly, you need more. You definitely need more. For women who are, on a calorie reduced diet to lose weight, they also need extra protein to mitigate the muscle loss that can occur with eating fewer calories. And so that recommendation is 1.2 grams of protein for every kilogram. And then for women who are in the gym and really wanting to put on some muscle, it takes a good 1.6 grams of protein per kilogram body weight per day.
Okay. Fantastic. And don't forget too, if you are experiencing, heavy periods, you want to get a check of your iron levels, your ferritin levels, because anemia can make you feel a little bit short of breath, have less energy. And you certainly need to have good energy in order to be working out, to be putting on that muscle. So that's another thing we should probably just mention.
No, that's a good point. And I think too, when we're talking about the 30s, this is a decade when many women will go through pregnancy. So it's a time to really be preparing your body, nourishing your body so it can support a healthy pregnancy. So iron is one thing, just like you say, making sure that you're taking a multivitamin and mineral supplement that contains 0.4 to 1 milligram of folic acid, a B vitamin that's really important to prevent serious birth defects. So it is overall a decade when we really should be nourishing our body, holding on to muscle, choosing nutrient-dense foods.
Absolutely. And now let's move on to the chaos of the 40s.
Yeah, let's talk about that. We certainly know as estrogen levels decline, that can lead to perimenopausal symptoms. I mean, I've experienced some of them for sure.
Oh,
Hot
me
flashes
too.
were mine.
Yes,
Hot
okay.
flashes were mine. So talk to us about this period, this menopausal period.
So it's, in general, hormones are all over the place. It's quite chaotic in your 40s, but overall, the trend of the estrogen and progesterone levels are to decline through the 40s. And it's both the chaos and the decline that's causing all of these symptoms. Now, 80% of women experience some form of symptoms of this perimenopause phase or transition, right? And that's a lot of women out there who are struggling with either hot flashes, brain fog, anxiety that they say just comes out of nowhere and it can strike at night. So often insomnia can be a big part of it, fatigue, feeling like you just don't have your mojo, you don't have your energy. I know I can definitely relate to these feelings as I go through perimenopause myself. It's really impacts every aspect of your life, from your work life, your home life, your relationships, and just your self-confidence. Your self-esteem can take a big hit during this time because things feel so out of your control.
So Jen, what do you tell women, because I hear this all the time and I'm asked this as well, who are looking to balance their hormones, whether that's from diet, a supplement, or hormones themselves? What do you say?
Right. So it's a myth to be able to balance your hormones, really. I mean, they're not going to be balanced. They're intended to be a little bit chaotic as your body's going through these natural and expected changes. Unfortunately, supplements have never been proven to have much evidence in terms of helping minimize the symptoms. Because when we talk about hormone balance, what we're really talking about is minimizing the symptoms that you're experiencing from these fluctuations. So it's a big business, supplements, these happy hormones and all of these things are a big, big business. Unfortunately, there's no clinical studies There's no batch testing. We don't quite know. Some of them say proprietary blend, which is really just code for, we're not going to tell you what's in this, which is, I certainly wouldn't want to take something and spend a lot of money on it if I wasn't being told what was in it. And most importantly, the women that I see who have tried all of these remedies, they come back and say, it just didn't help. It didn't work. It didn't do what I was hoping it would do for me. What does help is menopause hormone therapy, in one form or another. And there are so many options. For the vast majority of women, they're very safe. And the way I explain it to my patients is, what we're trying to do with menopause hormone therapy is give you back low levels of estrogen and progesterone. They are not trying to replace what your ovaries were producing at their height of fertility. But what we're trying to do is minimize those lows. We're sort of giving you this low, constant level of hormone that can help to really minimize and in many cases eliminate the symptoms of perimenopause that are so dramatic. Now, one thing it doesn't unfortunately help as much with are the skin changes that come with perimenopause. A lot of women start to experience thinning of the skin, very dry skin, very itchy skin, or unfortunately, acne. We think we're finally through all of that, and then it comes roaring back in our 40s. Not always helpful to use menopause hormone therapy for those cases, but there are so many wonderful dermatological treatments and approaches that can be taken towards skin changes of perimenopause. So it's really important to speak to your doctor, to see a dermatologist, to make it very clear that you're in perimenopause, because they might not be thinking about it. It's not always at the forefront. It's always at the forefront of my mind because it's what I do, but it's not always at the forefront of every other physician's mind. So they have to start speaking up and advocating for themselves. And in terms of, the last thing I'll mention from a medical perspective is breast cancer screening is now, as of October 2023, it's in the Ontario guidelines that women should start having regular screening for breast cancer starting at age 40, and they do not need a doctor's referral. So please don't take no for an answer. If you go to your doctor and they try to tell you shouldn't or can't have a mammogram, something I hear, unfortunately, far too often, call up your nearest clinic that offers breast cancer screening and tell them you are 40 and you're ready to start your mammograms, and they will happily book you.
I want to go back to menopause hormone therapy.
Yeah, sure.
You are not talking about bioidentical hormone therapy, are you? So talk a little bit about that.
No, that's a great point. So, I know that there's a big push out there. There's a lot around in social media, especially around bioidentical compounded hormones. So what this basically is it's allegedly compounded to be the correct dose for you to match your hormone levels in some way. And it is a cream usually that is created for you. Again, it's never quite clear what is in it, how much hormone, what sort of additives are in it. And then it's provided to you usually out of pocket because Health Canada doesn't recommend or approve of these products. And what the studies have shown is pretty interesting. You tend to see lower levels of estrogen in women who are on bioidentical compounded formulations than women who are on traditional Health Canada approved formulations, which would be a gel, a patch, or an oral estrogen. So this is interesting because, it's not that women are necessarily being overdosed on these hormones. It's that they're being underdosed. And it's no surprise to me that when I speak to women who have tried compounded formulations, they'll often tell me that it's highly variable what they experience from month to month on these formulations. Some months they say it feels a little better. Some months they say they're back to their baseline. They don't get any consistent improvement in their symptoms. And then there's the pellet forms of therapy, which are completely not evidence-based. These are different. These can be testosterone or estrogen that are inserted under the skin every 4 months or so. I often see women who are overdosing on testosterone.
Oh, wow.
From using these pellet therapies. Again, they are not as advertised. They do not give a slow, steady release of the hormone. You tend to have a very high dose of testosterone, and then it just, wanes very rapidly over the ensuing weeks. And of course, we need to keep female patients within a female range of testosterone. Otherwise, you start to see quite dramatic side effects like enlargement of the clitoris, deepening of the voice, acne, hair growth in places where women don't traditionally grow hair. I don't know anybody who's looking to have these kinds of side effects. So it's really important to seek out evidence-based, Health Canada approved menopause hormone therapy.
And one other question I have for you, because this, I hear this often too, and you see it on social media, the Dutch test.
Oh, yes.
What exactly is that?
So this is a dried urine test that I'm going to use the word allegedly checks your hormone levels. And when I hear about things for the first time, I approach them with an open mind. I always look into them. I see if there's any evidence. There is no evidence that Dutch testing is accurate. There is no evidence that it helps guide or manage therapy. The biggest thing I'll say is that other than maybe checking your hormone levels at baseline to make sure that nothing else could possibly be explaining your symptoms, like a thyroid disorder or something like that, there's no need to be checking your hormones when you're on hormone replacement therapy. If you are on an evidence-based Health Canada approved therapy, we know exactly what you're getting. We are completely guided by your symptoms. All of these tests are just to generate, twofold really, to generate money for the provider because they are big, big money makers. Secondly, this is my own sort of theory, I think they're testing to see how much hormone you're actually, that they're not overdosing you,
I see.
If you're giving compounded or unregulated hormones, you sort of have to check to make sure you're not overdosing people on, like I said, testosterone or progesterone.
Right.
That's a big red flag for me. If someone says you need ongoing testing, if someone says you need a Dutch test or a saliva test or whatever else they're going to come up with next, that's a big red flag. So run, don't walk to another provider. And let's turn around now, because one of the questions I get the most is, what is going on with my body in my 40s? Why am I gaining so much fat around the midsection? Why do my pants not fit? What can I possibly do? I feel like I'm eating well. I feel like I'm exercising, and yet the game has changed. So from a nutritional perspective, what can women expect in their 40s, and why is this happening?
Well, during the menopausal transition, with the decline of estrogen, women become more efficient at storing fat around their middle. And that's going to happen. It doesn't necessarily mean that they're going to gain pounds on the bathroom scale. Some women do, but often what I see in my practices, that often can be attributed to lifestyle factors, their current diet, lack of exercise, that kind of thing.
Yeah. So, I think people want to say it's your metabolism, right?
Yeah.
We both know the evidence does not point to a change in
metabolism.
metabolic rate. There's no change in your metabolism.
Yeah.
But I think we're not really acknowledging what does change about our lifestyle and about most of us in our 40s, right? We're sitting down most of the time.
Oh, absolutely. And I tell women it absolutely is possible if you are carrying extra weight. It's possible to lose it by looking at your overall diet, reassessing your portion sizes, and being physically active, and that's really, really important. And I am sure the workouts in the gym are great. You want to do your resistance training, get some good cardio in there for cardiovascular fitness. But what we've lost a lot of since COVID, during COVID, is that daily physical activity, that low intensity exercise that really makes a difference over the longer term for weight control. So your metabolism doesn't automatically tank during perimenopause.
Okay. And so I get a lot of questions too about fiber. People are a little afraid to overdo it. They're very afraid to underdo it. We see a lot of, IBS-like symptoms. We see a lot of people with digestive concerns. What's your approach to fiber and other nutritional needs as we age and as we get into our 40s?
Well, I think fiber is always important for a number of different reasons, not just gut health, but helping guard against type 2 diabetes, heart disease, stroke, colorectal cancer. It helps getting enough fiber, helps to, slow the rise in blood sugar after eating. It helps to lower LDL cholesterol. It does a lot of things. And so we do have daily requirements for fiber. Up until the age of 50, women are advised to get 25 grams of fiber per day. After the age of 50, when calorie needs decrease somewhat, that recommendation comes down to 21 grams a day. And a mix of fiber-rich foods, whether that's whole grains, beans and lentils, fruits, vegetables, the usual sources. I will say, though, there has been research from a longevity standpoint, getting older, free of chronic disease, that for everyone, males and females, whatever your age, 30 grams a day seems to be the sweet spot. I encourage clients to shoot for 30 grams a day. Try to get 10 grams of fiber at each meal if you can. And that would be my recommendation.
That's fantastic. I try to be as holistic as possible when I'm advising my perimenopausal and menopausal patients. So for people having hot flashes, they often are reading online or they're asking about dietary approaches to hot flash management. I know there have been some studies with respect to this, but what do you have to say about the evidence around managing your hot flashes through diet?
I think there is evidence out there for some women. It can help. It's certainly, if you're having severe hot flashes, diet alone isn't going to do the trick. However, there are some things absolutely that women should try if they're experiencing them. First of all, I tell my clients, definitely try avoiding foods and beverages that can trigger or worsen hot flashes. Caffeinated drinks, alcoholic beverages, spicy foods, even hot drinks sometimes can bring on a hot flash. But there is research to suggest that, following a Mediterranean style diet can help to prevent or reduce hot flashes. And this was a pretty recent trial. And so that means what I said earlier, really just eating fruits and vegetables, whole grains, beans and lentils, nuts every day, including those foods in your diet, making extra virgin olive oil the principal fat in your diet, cutting back on red meat if you need to. So that has been studied. So really following an overall anti-inflammatory dietary pattern may help, but also back to the soy that we just talked about earlier, including soy regularly may also help reduce severity and frequency of hot flashes. Studies have shown that.
That's fantastic. And what about alcohol intake?
So, in Canada, where we live, the new safe drinking guidelines came out January 2023, really saying that there is no safe level of alcohol consumption. But in terms of having the lowest risk of adverse health effects, the recommendation is no more than 2 drinks per week.
Right. This is a big shock to a lot of people.
It was a shock to many people, yeah. And going up to 5 drinks a week was associated with a moderate risk of adverse health effects, and higher, the risk increased steeply. So that's what I recommend to clients for sure. Whether they want to listen to it or adhere to it, that's really up to them.
Yeah. And actually 7 or more drinks a week, which is, we're talking about a 5-ounce glass of wine, 1.5 ounces of liquor, or 1 12-ounce beer is considered one standard drink, one serving. So 7 or more is associated with high risk of multiple types of cancer, including breast cancer.
That's right.
Colon cancer, heart disease, heart attack, stroke, coronary plaques. These are all associated with high levels of alcohol. So, often I'll say to my patients, I assume you're coming to take care of your health because you care about reducing your risk. And I'd be remiss if I didn't tell you that alcohol intake at high levels is one of the biggest risks that you could possibly engage in. So I think it's been very eye-opening to see the change in the guidelines, but I think it's very important that people are aware of the specific numbers and if they want to work on portion reduction as they would perhaps with their meal intake.
With their diet. Yeah, absolutely.
A little bit less wine in your glass, maybe. If you still want to enjoy a glass of wine with dinner, maybe have 2 ounces, instead of 5. And that way you're reducing your risk overall.
Your 40s is a really important time to be proactive about healthy eating. As we age, our risk of heart disease, osteoporosis, certain cancers, dementia, they all increase. And eating a healthy diet can help to reduce those risks. So it's really important, as we've been saying, for women in their 40s to, follow a healthy diet, get a mix of aerobic and resistance exercise, prioritize a good night's sleep as well. So important. And really try to find strategies too, I think, to help you cope with stress beyond the exercise and being well rested.
Absolutely. It certainly doesn't get easier over time to establish those habits if you don't start taking control of them when you're in your 40s. And that leads us to our next decade.
The 50s, embracing menopause.
Woohoo.
Yeah. So what do you hear from your patients who are in their 50s?
Yeah. So, I mean, there's often a little bit of confusion about what exactly menopause is, right? Like menopause is a moment in time. Perimenopause is this whole fluctuation and crazy chaotic time that we've been talking about. But menopause is that moment in time when you've gone a full calendar year without a menstrual period, right? Unless you've had surgery. And in that case, it's the moment that you had your uterus removed. You're basically menopausal at least from a bleeding perspective, right? The average in Canada is about 51, but it can happen anytime between 45 and 55. So some women have their final period around 55 or perhaps even later. What tends to happen from a hormonal perspective is that at some point, a year or two after the final period, the hormone levels come back into a nice flat line almost on a graph. They're very stable once again. This doesn't necessarily mean that the symptoms stabilize, unfortunately. And many women continue to have symptoms long after their final period. But at least from a hormonal perspective, things stabilize quite a bit after this point in time. But whether your symptoms settle down or not, the changes in your body continue. As you mentioned, the accelerated decrease in muscle mass and an accelerated decrease in bone mass, which happens predominantly over the menopause transition. And yet many women don't even think about their bone density until they're in their 60s, when they're already at a high risk of having a fracture of their hip or their vertebral column. And these can be really devastating from a quality of life perspective.
And certainly with the loss of estrogen's protective effect on bones, actually at the age of 51, a woman's daily calcium requirements increase from 1,000 milligrams a day to 1,200 milligrams a day in order to protect bone density. And women really do have to be deliberate about getting 1,200 milligrams of calcium a day. If you're doing it solely from diet, that means consuming 3 servings of milk or milk alternatives each day, plus getting other calcium-rich foods in your diet like bok choy, like rapini, tinned salmon with the bones, firm tofu or other examples. And just for perspective, 1 serving of milk or milk alternative is 1 8-ounce cup of milk or a calcium-fortified non-dairy milk, 3/4 of a cup of yogurt, or 1.5 ounces of cheese. So, for a lot of the clients I see, a lot of the women I see, 3 servings a day, it's a lot. It's hard. So certainly some women will need to bridge gaps in their diet with a calcium supplement. And I typically recommend a calcium citrate supplement. It typically provides 250 to 300 milligrams of calcium, which mimics the amount that's in 1 milk or milk alternative serving. And then, of course, really making sure to checking their vitamin D level, making sure that they have a sufficient level in their bloodstream that's associated with better bone health. That usually requires taking a supplement 1,000 to 2,000 international units a day typically, but some women may need more depending on their vitamin D level.
Yeah, that's great advice. And I like that you mentioned some non-dairy sources of calcium, because we often associate calcium purely with dairy products. And a lot of people are avoiding dairy either for preference or they don't want to have any animal products or whatnot. So I think it's really important to recognize that calcium is not just in dairy. There are other sources if you are struggling to meet your needs, your 1,200 milligrams a day.
Yeah, absolutely.
And what about, how can women find out if they are getting enough calcium?
One simple way to do it is go online, search for calcium calculator. Osteoporosis Canada has a really great one, and women can take a look at that and add up their daily calcium and find out other good sources. Oh, I can add this to get what I'm needing. So that's a really great tool that's out there.
That's great advice. And I really encourage everybody to make sure, because I know from my experience, at least 50% of the clients that I see are deficient deficient in terms of their calcium intake. So it's really crucial. And we know everybody's vitamin D deficient because if we live this far north of the equator, it's almost impossible to get enough vitamin D from the sun.
Yeah, well, and if you properly use sunscreen, that blocks 95% of vitamin D production in your skin. So
yeah, so we're sort of stuck between a rock and a hard place. We want enough vitamin D, but we don't want any sun exposure. So yeah, I think the supplement is the most important thing that people can take. And they'll often say, I have it, it's in my cupboard. And I'm like, well, it works much better if you actually ingest it. So
yeah, and I think people just need to remember that very few foods contain naturally occurring vitamin D. So the supplement is necessary.
And, we're talking about bone density. It is important to get your bone density screening. Certainly, if you haven't had one by age 65, you should speak to your doctor about having one. But starting at age 50, really, you should be asking your doctor to determine with you whether you would qualify for early screening. And this can depend on some personal risk factors, family risk factors. And don't just, wait until you're 65 to find out that, you have osteoporosis. You can certainly intervene in a much more meaningful way if you find out that you have, say, low bone mass or normal bone mass, but your risk of a fracture might be a little bit higher. And so it's really important to be proactive about your bone health because as I mentioned or alluded to, a hip fracture is a devastating quality of life issue. 50% of people who sustain a hip fracture lose their independent mobility within a year of the fracture, and 25% are actually dead a year after sustaining a hip fracture. And we don't think about it very often. We worry about so many other things, but we're not thinking about the things that are actually impacting far more of our elderly, relatives, friends, companions than the things that we tend to think of at the front of our mind. So then, the 50s sort of segue into the 60s. Because it's not that anything necessarily changes from a hormonal perspective. Things continue to sort of decline at much more, I would say, of an even pace beyond the 50s. I often hear patients say, I just feel like I'm kind of running out of steam. This certainly increases even more as they get into their 70s, and then even more as they get into their 80s. And yet we know from a physiological perspective, from a medical perspective, the needs aren't necessarily changing. So what do you attribute this to, this sort of decline that seems to happen decade over decade?
I think some of it is very likely attributed to just being less physically active as women or men as well get older and move into their seventh and their eighth decade. So when you're more sedentary, you feel less mentally and physically energetic. In our 60s, it's time to really double down on protein. We talked about protein earlier, but age-related muscle loss is now increasing faster than it did before. In order to preserve that muscle strength and muscle mass, we do need to eat more protein because the gradual loss of both of those things can lead to sarcopenia, that skeletal muscle disorder that can significantly impact the quality of someone's life. And as we get older in our 60s, we aren't able to turn protein into muscle as efficiently as we did when we were younger. So we need to eat more of it to support muscle health. So at this time of life, it's recommended that older adults consume 1.2 grams of protein for every kilogram they weigh each day. And that certainly is an amount that's higher than the official daily recommended intake we talked about earlier. If you're in your 60s or even in your 70s and you want to build more muscle, you need more than that. But it's not only important to eat enough protein, you also need to distribute it evenly across your meals. Studies have associated better muscle function, better muscle strength. If you do that, if you divide it over the course of your meals during the day, as opposed to skewing all your protein to the end of the day at dinner time. So I think that's a really important takeaway as well.
That's really important. And that reminds me also of, there's a trend, and this applies across the ages, I guess, but the trend towards intermittent fasting. So it would seem counterintuitive to engage in intermittent fasting, especially at this age where we want to be making sure we're taking an adequate protein throughout the day.
That's right. If I have a client that, no, absolutely, I like time restricted eating, the most popular version of intermittent fasting, where you limit, your eating window is 8 hours. And with our busy lifestyle, it's just easier to skip breakfast and start with lunch. If people want to do that, okay, it may not be ideal from a muscle protein synthesis standpoint because you're missing a hit of protein earlier on in the day. But if you're going to do that, my advice would be make sure that absolutely lunch and dinner and your meal mid-afternoon or your snack, whatever it is, it needs to be protein rich so that you're not getting too little protein during the day.
That's great advice. And something we didn't talk about that definitely impacts mobility and it increases with age is pain. I was looking at a study recently that really demonstrated that, it's not that there's this slow, steady decline in physical activity that happens with age, but people tend to experience pain at some point or an injury, and then it's a steep decline in their level of activity, and then they never quite get back to their original baseline. And then another injury happens or another setback and another steep decline. And and each time the baseline they get back to is lower and lower. So I like to sort of explain to people that they really have to see pain as, yes, a challenge, but something that they need to adapt to in whatever way they can. So if you have to have a flexible approach to your physical activity.
Right. Yes.
If you hurt your knee, that's fine, but there's no reason that while you're rehabilitating your knee that you can't be doing some exercise with your upper body or doing some adaptive exercises.
That's right.
I think we tend to stop moving altogether as a natural response to pain.
Mm-hmm. Yeah, that's a good point.
And so I think it's just recognizing that movement is so vital as we get older that you really can't stop. You have to find ways to work with what you have and keep yourself mobile and active. There's also a bit of a myth that exercising and putting on muscle can reverse a loss of bone density. This isn't true, unfortunately, but what being active and strong really does is prevents you from falling.
Mm-hmm.
So if you're not going to fall, if you're going to stay agile and flexible and strong, you're not going to fall and you're not going to sustain a fracture.
In our 60s and beyond, it's just really important to be continuing to follow a diet that's based on nutrient-dense, whole, and minimally processed foods. We know that diet quality is a leading predictor of chronic disease risk. And so following that healthy anti-inflammatory diet pattern, whether it's a Mediterranean diet, whether it's the DASH diet or the MIND diet for brain health, a healthy anti-inflammatory diet pattern is strongly linked to living a longer life in good health. So, overall, your diet and your nutritional intake are so important in your 30s, in your 40s, 50s, 60s, and well beyond. And by the way, if you're looking for more information about nutrition for women, I talk a lot about this in Eat, Move, Think episode 160. It's called What Every Woman Should Know About Her Nutrition.
I think that's very well put. And certainly we know that the risk to women particularly increases in terms of cardiovascular disease, of dementia, of a lot of chronic disease increases after menopause. And that's because, the leading theory is there's a protective effect of estrogen. And in reality, we just sort of catch up to where men are eventually. And so although women are living longer than men, unfortunately, it's the quality of life and their health span, the lifespan versus the health span. Their health span can tend to be shorter than men's, meaning the number of quality years that they have in their life after menopause. So I think if they take our advice today and they start when they're young and they realize that it's never too early and it's certainly never too late to start making positive changes.
Yeah, well said. Very well said, Jen. It's been great chatting with you today.
It's been great chatting with you. Of course, it would be great if people want to send us some questions that we can answer maybe in a future chat. Feel free to send us your questions on Medcan's social media. You can find us at LinkedIn, on YouTube, X, and TikTok, or on Instagram at Medcan Live Well. And thank you all so much for listening. Have a great day, Leslie.
Yeah, you too, Jen. Thanks so much, everyone. Be well.
That was Medcan's Clinical Director of the Menopause and Perimenopause Program, Dr. Jennifer Zelovitzky, in conversation with Leslie Beck, Registered Dietitian and the Clinical Director of Food and Nutrition at Medcan. To learn more about Medcan's women's health programs and Medcan's weight management and nutrition programs, visit medcan.com. Follow Medcan on X and Instagram and subscribe to us on YouTube at Medcan Live Well. We'll post episode highlights and other links that you can visit on medcan.com/podcast. Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com. Eat Move Think is produced by Ghost Bureau. I'm Jasmine Ratch, managing producer. Social media and strategy support is from Chantal Gertin, Andrew Imex, and Elaine Genet. Executive producer is Christopher Shulgin. We'll be back soon with another episode examining the latest in health and wellness. This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.